for this on behalf of BPNI Maharashtra. I am very happy to welcome you all to this unique program which we are launching today. And the program is not unique, but the platform that we are sharing it with is unique. We had off and on meetings of our faculty core group of BPNI Maharashtra where we used to revise, discuss, but we felt, all of us felt that now the time has come where the wider BPNI members, according to their wishes, join this particular program and contribute. So this program is not just meant to be a didactic program with guest speakers coming in. It's also meant for you all to contribute to this program. You want to present, you want to discuss cases, you want to have whole panel discussions. This is the platform for you. Very happy to tell you that we are 1100 plus members on our BPNI register now. And I feel that if more and more people start participating and sharing their experiences, we would learn very fast. And as all of you know, most of the BPNI programs which are free of cost, we don't charge because we feel that knowledge should be shared freely. And so all of you can take advantage of this program. Right now, the capacity that we can deal with is only 100, but if we find more interest and enthusiasm, only thing few tips while you are contributing to this program. As all of you know, we all follow and implement IMS Act also. So none of the presentations, none of the the whatever you present should be sponsored by any IMS company. Not just the IMS companies, but also we do not take any help from a pump manufacturer or accessories manufacturer or any baby product where there is a conflict of interest. So no conflict of interest as far as industry is concerned. No advertisement of personal programs. No advertisement of personal workshops or whatever. So you can share knowledge and you can contact us at mahbpni@gmail.com, MAH for Maharashtra, mahbpni@gmail.com, or Dr. Sushma Malik in the end she'll also share, we'll share her email address also. So the next program will be after 15 days, that is on 17th of April. And if people contribute in next 7 days, then we'll post something from our group for that particular program. If not, we'll arrange for a guest speaker in the meantime. So either guest faculty. So very happy to welcome you all for this program. Or Hamara, we are very lucky that we have Dr. Rajinder Gulati as guest for this program. I welcome him too. We have been meeting for many, many years now, perhaps more than a decade in offline meetings. And I was very impressed by his presentations, his talking style. Anyway, I'll talk about it. But I request, before we start, I will request Dr. Sushma Malik, our president, to introduce Dr. Gulati.
Thank you, Prashant. And I'm just sharing. Has it started sharing? Yeah,
Yes.
just a minute. So once again, a warm welcome from BPNI Maharashtra, and I'm so happy to see that so many people have joined well before in time. And of course, there'll be lots of people still trickling in. And a warm welcome to all of you. And we are indeed honored to have a very senior consultant pediatrician, and it's none other than Dr. Rajendra Gulati. And what is very intriguing is that, sir, though he's so senior, he is very much not only tech savvy, but social media savvy. And so we have loads and loads of videos which are present both on Instagram as well as on YouTube. I think it's only YouTube. Sorry, maybe sir can correct me. So sir keeps releasing all these videos, and it is they are very simple to understand and learn, and they're all based on his experience, in addition to, of course, all of us refer to the scientific data. Sir has been in the Mother Child Hospital and Urban Community Health Center, and he has an experience of 34 years with a special interest in IYCN and neonatal resuscitation and vaccinology. And in 2022 and 23, he was a president of the Human Milk Banking Association of India. And under his guidance, number of human milk banks were started. He's also the National Advisory Board member for the IAP Journal. He's been an executive board member for the Central IAP, a treasurer, secretary, and president for the IAP Punjab. He has several publications to his credit and a lot of expert articles, especially in the print media and in the AV media. Of course, he gives a lot of broadcast even on radio as well as TV. And obviously, with being so senior and working so hard, he has numerous awards to his credit. He's been a faculty in the scientific meets and public education programs. And I think with that, and of course, a contributor for the national health programs, which are not just limited to IYCF, but also to polio and BNCRP. So, welcome, sir, on behalf of not only myself, but also on behalf of BPNI Maharashtra. And over to you, sir, we are all eagerly waiting for your words of wisdom.
Before Dr. Gulati starts sharing his presentation, I have a few words to say him about also. I met him maybe about 15, 20 years back, and what struck me was his energy. You know, he's always energized when we meet him. That energy gets reflected in his presentations, his talk to you, and is very straightforward. And मराठी में एक कहावत है, मूर्ति लहान पण कीर्ती महान. So we will hear through his presentation, though the topic is very common, initiation. What we have to learn from these intelligent and experienced people is that how they have looked at that particular topic and their experiences with this simple topic, as simple a topic and very prime topic as initiation. So we are very lucky to have him. And I had spoken to him about this about a year ago कि सर आप एक बार हमारे platform पे आ जाइए. And of course he willingly agreed. And there are very few people left now in India where you can who would willingly come and talk with interest. So over to you, Dr. Gulati.
Okay. Thank you, Dr. Sushma Malik, for your kind introduction, and Dr. Prashant, my IYCF friend and now friend in person as well. So I'm sharing my screen. Yeah. Is it okay, I suppose?
Yes, sir.
Okay.
सर अपने कैप्शंस ऑन रखी हैं, नीचे आ रही हैं कैप्शंस.
चलो कोई बात नहीं, let it continue because hardly makes a difference for me. So good afternoon, everyone. At the outset, I would like to express my heartfelt gratitude to Dr. Sushma Malik for this opportunity to share my thoughts and experiences at the inaugural IYCF clinics at Maharashtra BPNI. It is truly honored to be here with such a distinguished uh, audience. Maharashtra has been a hub of IYCF excellence, as I've just been come to know from Dr. Prashant. Home to stalwarts like Dr. Sushma Malik, not only Maharashtra but globally, she's famous for it. Dr. Prashant, Dr. Jayan Shah, whom I know personally and who have contributed to this fields are truly commendable. Now, building on this strong foundation, today's session will focus on effective strategies for initiating breastfeeding within first hour after birth, whether following vaginal or cesarean delivery. Let's begin with our first slide. Although the topic is very, very easy, just as Dr. Prashant said, I can finish it in one slide, but that wouldn't solve what I need to share with you. So today's topic, early initiation of breastfeeding, is both close to my heart and crucial for well-being of newborns. WHO and UNICEF emphasizes early initiation within 1 hour of birth, exclusive breastfeeding for 6 months, and continue breastfeeding for up to 2 years or beyond, alongside appropriate complementary feeding. Today, I'll just focus on the first and most pivotal step, that is early initiation of breastfeeding within 1 hour of birth. My aim is to share my perspective, although everything is written in books, but the experiences on why this practice is essential and how we as healthcare professionals, caregivers, and advocates can promote and support it more effectively. So, initiating breastfeeding is not as simple as pressing a start button on a gadget, nor it is instinctive in humans the way it is in other mammals, where newborns begin suckling without any external help. Just the presence of their mother is needed. Take a look at this short clip. So, do you think this would be possible in humans? Can a mother replicate what you see in the video? The answer is no. In humans, early initiation of breastfeeding and successful suckling requires trained support. This is a key lesson I have learned over the years. Now, in today's session, we will be discussing the significance of timely breastfeeding initiation under the following key headings. Why early breastfeeding matters, or why we need to start breastfeeding within 1 hour after birth. What is the current status of early initiation? We'll be comparing it with the number of institutional births as well. How to support mothers to breastfeed within first hour after vaginal or cesarean birth, and what are the reasons for delayed initiation and steps to ensure timely initiation. Now let's first see why an early breastfeeding matters. If you see, the risk of neonatal mortality increases significantly with delays in initiation of breastfeeding. It is noted that the late initiation of breastfeeding, defined as after the first hour of birth, is particularly concerning. You can see from the graph, the more the delay, the more is this risk. Such delayed initiation is associated with six-fold increase in the risk of neonatal death after 3 days of life. So definitely this statistics underscores the critical role of breastfeeding in protecting newborns against life-threatening conditions during the early days of life. Again, you can see here the potential impact of early breastfeeding initiation on reducing neonatal mortality. It suggests that if we initiate breastfeeding from day 1, approximately 16% of neonatal deaths could be prevented. Furthermore, if breastfeeding was initiated within the first hour after birth, the potential reduction in neonatal deaths could be even greater, with an estimated 22% of deaths being avoidable. Let me tell you before going further, uh, I would like to share with you the advantages which this early breastfeeding provides. I think so there's something wrong with my slide show.
सर आ गया है वो.
आ
It
गया,
is
ठीक.
coming.
हाँ, ठीक है. Initiating breastfeeding within the first hour ensures that the baby receives the vital benefits of colostrum. Now, every one of us knows what colostrum is, and the earlier we give colostrum, the better it is. It plays a protective role in newborns from infections because of its rich content of anti-infective proteins. Additionally, colostrum also helps prevent infection because of the vitamin A content, which significantly reduces the severity of infections. Now, colostrum also helps prevent jaundice due to its gentle laxative effect, which aids in clearing meconium from the gut. thereby preventing severe jaundice. Moreover, colostrum helps to prevent intolerance and allergies because of the growth factor it has, which promotes the growth and maturation of the intestinal villi. This development helps prevent the absorption of undigested proteins that could cause intolerance and allergies. Now, moreover, it's not only the benefits of the colostrum, there are many other benefits like emotional bonding between the mother and the baby by promoting release of oxytocin and love hormone, which fosters maternal attachment and provides a sense of security to the newborn. It also stimulates breast milk production as the baby's suckling triggers oxytocin and prolactin release, ensuring an adequate milk supply. Additionally, it helps regulate the baby's body temperature. So it's not only the nutrition part which we are providing through colostrum, but many other things. When we talk about low birth weight and sick babies, now this colostrum or early initiation of breastfeeding is not just for full-term healthy babies who benefit. Preterm low birth weight and sick newborns rely on it even more. Let's explore the key benefits for this vulnerable infants. Now, breast milk has immune boosting properties, significantly reducing the risk of late onset sepsis by 19% in the first 28 days as compared to formula fed infants. So you can very well imagine what benefits are we getting. Feeding low birth weight infants with human milk, whether maternal or donor, drastically lowers the chances of developing necrotizing enterocolitis. The risk of reduction is as high as 79% when formula feeding is avoided. Babies fed unfortified donor human milk show better tolerance to feeds. That's the reason we want to initiate early. They have fewer instances of vomiting, reduced gastric stasis, and less diarrhea, leading to healthier digestion. Low birth weight babies fed donor human milk tend to experience fewer complications. That's the reason which lead to reduced duration of hospital stays in NICU. Feeding with donor human milk or early initiation of breastfeeding in neonatal intensive care units has been associated with reduced severity of retinopathy of prematurity, a condition that can lead to vision loss in preterm infants. Now, while DHM may seem expensive initially, it proves to be a cost saving in the long run, and early exposure to donor human milk sets the foundation of the healthier growth and development. NICU with human milk bank, it has been seen that about 13% higher rates of exclusive breastfeeding is there in the babies who are discharged from the NICU. Let's have a look at the current status of early breastfeeding initiation and how it compares to the number of institutional births. If we see here, the national average of early initiation of breastfeeding in India is 41.8. However, state level rates vary significantly, ranging from 21.5 to 78.8. We will explore the factors contributing to these variations later. Maharashtra and Punjab have initiation rates of 53.2 and 53.1 respectively, both above the national average, but still falling short of the best performing states. Now here we see institutional deliveries have increased significantly not only in India, but world over. Whereas the expected rise in early breastfeeding initiation has not kept pace, highlighting a crucial gap in postnatal care. You can see the percentage of births occurring in healthcare facilities, which rose from 53% in 2005 to 71% in 2017 across 58 countries with available data. However, despite more institutional deliveries, the rate of early breastfeeding initiation increased from only 45% to 51%. This data indicates that hospitals and birthing centers are not fully utilizing the opportunity to support immediate breastfeeding post-birth. While institutional deliveries have increased significantly in all these states, the expected rise in early breastfeeding initiation has not kept pace in India, highlighting a crucial gap in postnatal care. Let's have a look at the key trends in India. This graph highlights relationship between institution deliveries and early initiation of breastfeeding in the highest and the lowest performing Indian states for institutional births. Institutional birth vary from 75.8 in Jharkhand and the lowest to 99.8% in Kerala, the highest. However, the corresponding rates of early breastfeeding initiation are significantly lower at 21.5 and 66.7 respectively, underscoring a critical gap in immediate postnatal care. On average, India records 88.6% institutional births, yet the early breastfeeding initiation rate remains at 41.8. This disparity highlights that a higher number of institutional deliveries does not necessarily translate to timely breastfeeding initiation. I'm sure you must be keen to see how Maharashtra compares to other states. Coming from Punjab, I was particularly interested in comparing its early initiation of breastfeeding rates with those of other regions. Both Maharashtra and Punjab have rates above the national average, which is encouraging. However, these figures they remain significantly lower than the institutional birth rates, highlighting a critical gap in breastfeeding initiation at the place of birth. Now let's examine the impact of cesarean sections on early initiation of breastfeeding. Globally, the rate of cesarean section has risen from 13% in 2005 to 20% in 2017, posing a significant challenges for timely breastfeeding initiation. C-section use continues to rise globally, now accounting for more than 1 in 5 of all childbirths. You see here, the number is set to continue increasing over the coming decade with nearly a third, that is 29% of all births likely to take place by C-section by 2030. Now, there was a study across 51 countries. Why I am talking about cesarean section is it revealed that newborns delivered vaginally were more than twice as likely to begin breastfeeding early compared to those born via C-section. This is a reason why I am saying that we should take care of these C-section births also. This pattern was consistent in almost all countries with statistically significant difference in 47 out of 51 nations, again highlighting a crucial gap in postnatal breastfeeding support. Now, when we examine India's cesarean section rate, we find it's closely aligned with the global average 21.5 in India compared to 21% worldwide. However, when comparing the C-section rates of Punjab, my home state, and Maharashtra, your state, we find that both are already above the national average as per NFHS 5 data. What may be even more surprising is that Telangana leads the country with a staggering 60.7% cesarean section rate, followed by Tamil Nadu at 44.9%. It's a huge difference. Next, we will discuss how to support mothers in initiating breastfeeding within the first hour, both vaginally and cesarean births. However, before proceeding, it is essential to understand the physiology of newborn feeding. Just a slide on feeding reflexes. To understand the suckling process, it's important to know about the reflexes in babies that facilitate this action. These reflexes occur automatically in response to certain stimuli. There are three main reflexes directly involved in suckling: the rooting reflex, the sucking reflex, and the swallowing reflex. The rooting reflex occurs when something touches a baby's lips or cheek. The baby responds by opening their mouth and turning their head to find the object while moving their tongue down and forward. Ideally, this is the reflex which is responsible that the baby is searching for the breast. This sucking reflex is triggered when something touches the baby's palate, prompting the baby to start suckling. The swallowing reflex happens when the baby's mouth fills with milk, leading to swallowing. These reflexes are innate or automatic and do not require the baby to learn them. Holding the baby close and facing the breast stimulates the baby's reflexes, aiding in proper attachment. For many mothers and babies, this process occurs easily and naturally, as most healthy full-term infants can instinctively latch onto the breast. Okay, let's have a look how these reflexes develop. Only then we will be able to understand when can the baby suckle independently. Newborns from 28 to 31 weeks of gestational age may begin opening their mouths, moving their tongues forward and making licking movements. However, suckling remains ineffective. From 32 to 34 weeks gestational age, they start rooting, attempting to attach to the breast and may suckle weakly. Whereas from 35 to 33 to 35 weeks gestation, it's just an overlapping of weeks. Babies can root more actively and engage in organized suckling, effectively taking milk from the breast during brief periods. Breastfeeding can cover part of their intake. However, cup feeding or other alternatives are needed to ensure adequate nutrition. Further, most babies with gestational age 34 to 36, nearing 36, you can say, can coordinate suckling well, though some feeds may still require cup feeding. But most babies beyond 36 weeks gestation age are ready for full breastfeeding and can meet their nutritional needs directly from the breast. Sucking reflex in these babies is naturally strong. This behavior plays a crucial role in effective breastfeeding, which we will discuss further in the next slide. When we talk about early initiation, it ensures that the strong sucking reflex is put to immediate use, maintaining the baby's feeding competency and promoting sustained breastfeeding success. Now, early exposure helps infants to maintain and develop coordinated suck-swallow breathe patterns necessary for efficient feeding. The more the infant suckles, the better the feeding reflex develops and stronger the breastfeeding relationship becomes over time, thereby resulting in optimal milk transfer from the mother to the baby, which is essential for growth and development of the infant, enhanced milk production and supply, which is triggered by hormonal responses in the mother. Breastfeeding, if delayed, weakens the sucking reflex, leading to difficulties in latching and effective feeding, which can affect both nutrition and bonding. Now, proceeding further for preterm babies who are not yet breastfeeding directly, non-nutritive sucking, like using a clean finger, can help develop the sucking reflex earlier, preparing them for effective breastfeeding. Even during tube feeding, the mother can allow her baby to suck on her finger, which is believed to stimulate the baby's digestive tract and support weight gain by promoting gut mobility and feeding readiness. Remember, the mother must wash her hands thoroughly before offering her finger for the baby to suck on. Now here we come to the more practical issue of how to support mothers to breastfeed within first hour after vaginal or cesarean birth. Initiating breastfeeding after vaginal birth. First, we will consider vaginal birth. After that, we'll go to the cesarean delivery. In short, I'll not be going into the details of resuscitation. Once the baby is received in warm linen and placed prone on the abdomen of the mother, ensure that airways are open and newborn is breathing well or crying. The cord is clamped and cut between 1 to 3 minutes. The baby is then gently placed between the mother's breast for immediate skin to skin contact. This is a photo from my institution, and it was probably taken a couple of days back when Dr. Shishma said to me to speak on this topic. So I just wanted to present this photograph. If left wet and uncovered, because I just want you to remember that nutrition has to be taken uh, care of. But before that, resuscitation also is very, very important. Always keep the newborn dry. This is again of utmost importance when we are putting the baby onto the mother's breast. It should be well covered and clear of all visible secretions. If left wet and uncovered, they may struggle to breastfeed, become weak, and face a higher risk of infections. The mother should be encouraged to cuddle and hold the baby close, ideally within the first 5 minutes, to promote effective breastfeeding. This breast call position helps initiate breastfeeding within the first hour. Various breast call videos on YouTube can help you guide this practice. I believe Dr. Prashant is the best person to guide you on the breast call. And if he has not taken a session, I just would request him to do it as early as possible. um, Offer assistance to the mother to get the baby well positioned and attached, especially with the early feeds. She may have difficulty in lifting and holding her baby. So you need to make sure that someone is always available to help. A relative or friend can do this when there is shortage of staff, and usually ashas are now also available. Reiterating, initiate breastfeeding to skin contact immediately after normal vaginal delivery once the baby is breathing well. Encourage the mother to stay skin to skin with the baby as much as possible. Now let's explore the steps for initiating early breastfeeding after cesarean birth. Once it is confirmed that the newborn is breathing well or crying, the next step is to begin breastfeeding right in the operation theater. You need to place the baby skin to skin with the mother immediately after birth if possible. This is not in the theater, it's just after the cesarean. Even brief contact is beneficial. You need to support the baby to start feeding as soon as it shows signs of readiness, even if the mother is sedated. Help the mother find a comfortable feeding position. If it is in the operation theater, no, you cannot change the position of the mother. No doubt you can uh, bring the baby to the mother's breast uh, from different position, from different angles, from side, from above the shoulder, and football position likewise. Ensure that the baby is well positioned and attached, avoiding pressure on the stitches, especially during early feeds. Listen to the mother for emotional support and help rebuild confidence in her body's ability to nourish her baby. Ensure that a trained healthcare provider, staff member, or a designated support person is always present in the operation theater to assist with the early initiation of breastfeeding. This is the thing which we are missing. Somebody earmarked or somebody who's trained should always be available at the time of the cesarean birth. Summarizing, delivering a baby by CS is not a barrier for initiating breastfeeding within an hour of birth. Before moving forward, let's take a closer look at addressing the challenges associated with initiating breastfeeding after cesarean section, because there are many challenges, especially after CS. These challenges stem from multiple factors and can significantly influence a mother's infant feeding choices. Common barriers include restricted mobility after surgery, post-operative pain, and the need for continued medical care related to complications that may have necessitated the cesarean section. Additionally, limited support from healthcare professionals and partners, particularly during nighttime hours, often leads to increased supplementation with artificial milk. A lack of understanding regarding breastfeeding physiology and newborn feeding behaviors further impacts a mother's decision to breastfeed. Now, our acronym BREAST has been introduced as a structured approach to supporting mothers in postnatal wards who may feel hesitant to seek assistance with breastfeeding. Let's analyze the acronym. The first P, prepare the mother for cesarean section by providing targeted antenatal education on breastfeeding challenges and strategies specific to post-cesarean recovery. We'll come to this antenatal education soon. Relieve post-surgical pain to facilitate early breastfeeding initiation and sustained breastfeeding success. Educate mother, we have already said, educate mothers about lactation physiology and the significance of nighttime breastfeeding. Additionally, train healthcare providers as well. Stimulate breast milk production by encouraging regular breastfeeding sessions, including night feeds, while highlighting the risk of artificial milk supplementation. So the last S is about exclusive breastfeeding. Success in achieving exclusive breastfeeding for the first 6 months among the mothers who wish to breastfeed after cesarean birth. By implementing the breast strategy, healthcare providers can help mothers to overcome these barriers and improve breastfeeding outcomes following cesarean section. Now, when we are giving skin to skin contact to the baby, it's important to monitor the babies closely to ensure their safety while recognizing early feeding cues such as rooting, sucking movements, and hand to mouth actions. Assist the baby in latching as soon as they show signs of readiness. This timely approach supports successful early breastfeeding initiation and enhances bonding. While doing so, it is essential to monitor the baby's well-being. Very, very important. You need to ensure the baby's position, which allows for a clear airway. Observe breathing patterns, chest movement, and listen for any unusual sounds. Now, this resuscitation or newborn well-being should be first looked after before putting the baby to the breast. And simultaneously also check when the baby is taking the feed. Check or assess the baby's entire body for any color changes as the limbs may show early signs of discoloration. The baby should appear active with good muscle tone, not limp or unresponsive. Keep the baby warm to maintain a stable body temperature during skin-to-skin contact. Now, while supporting early breastfeeding, the following points should be kept in mind to ensure a smooth and successful start. We call these as a prerequisites for initiating early breastfeeding. Maintain calm and quiet environment by minimizing the noise and distractions to create a relaxed setting for the mother and baby. It may be in the theater, it may be in the labor room, it may be in the postnatal ward. Relatives, especially the male person, should not be allowed there. Mothers should be comfortable physically and emotionally. Encourage the mother to express any concerns about breastfeeding, pain, or difficulties she is experiencing and provide appropriate support and solution. You need to assist the mother to find a comfortable feeding position for good latching. Ensure that the baby is well supported and aligned to facilitate a deep latch. Observe a feeding session to assess effectiveness. Now, when you initiate breastfeeding, you have to help, you have to support the mother. But thereafter, when you visit the mother or within 1 hour, you need to observe this session again and again, so that you need to watch how the baby latches and sucks to ensure proper attachment. If you do not observe the session and do not correct the mother or the child, again the mother is not will not be able to effectively latch onto the baby, and the baby will not be getting enough milk. Provide guidance on the key aspects of breastfeeding like feeding on demand. This is what you have to do when you initially initiate breastfeeding. Teach mother to recognize signs that the baby is ready to nurse. We have already said this about prenatal education also, but definitely you have to do it as and when you meet the mother. Reassure the mother that frequent feeding stimulates milk production, or tell the physiology of milk production. Address questions. This is very important. Mothers might show her concerns. You need to address the question, encourage the mother to ask questions and clarify her doubts. Next, we will explore the reasons for delayed initiation of breastfeeding before exploring effective strategy to overcome these challenges. Yeah. Introducing bottles or pacifiers before establishing breastfeeding can cause nipple confusion, hindering proper latching and breastfeeding. This is a very common reason for delayed initiation. Then there are some family beliefs, culture practices which greatly influence breastfeeding. If elders favor formula or find breastfeeding inconvenient, they may discourage it. Traditions like feeding honey or sugar water before breastfeeding can delay colostrum intake, impacting early nutrition. So these society norms, values, attitudes are different for different states. Then there is a lack of knowledge about early breastfeeding. These benefits of breastfeeding may delay initiation because they don't have knowledge about breastfeeding benefits, as mothers may not prioritize skin to skin contact after birth. Yeah, in some cultures, this is very important. Again, colostrum is wrongly believed to be harmful or dirty, leading mothers to discard it and wait for white milk, depriving babies of vital early nutrients. Now, many mothers fear low milk supply early on. I hope everybody will agree. Seeing little milk, and it is a fact also, they can't see milk coming out of the breast. So seeing little milk, they may assume insufficiency unnecessarily, supplement with formula. Then separation of mothers and baby immediately after birth. Routine practices like nursery stays or unnecessary procedures. These can also delay breastfeeding. Post-cesarean recovery may also hinder early breastfeeding, leading to formula use. Then cesarean sections, excessive use of pain medications, or prolonged labor interventions can delay breastfeeding. Some hospitals routinely offer newborn formulas or glucose water as a standard practice, again which can delay exclusive or delay initiation of breastfeeding. If hospitals or healthcare providers do not prioritize early breastfeeding support, mothers may struggle to initiate breastfeeding. For example, it always happens in the government hospital in busy wards. Nurses may be too occupied to assist with proper latching. Now, lack of breastfeeding knowledge among healthcare workers or family can hinder early breastfeeding. An unskilled nurse may suggest formula instead of assisting with latching. These challenges can be broadly categorized into three key areas: the family and the community factors, the birthplace or hospital practices, and the healthcare professionals. Let's discuss how to address challenges in early initiation of breastfeeding. Overcoming delayed breastfeeding initiation resulting from family and community influences like cultural beliefs, traditions, and misinformation requires education, community engagement, and health worker support through workshops, videos, and illustrated materials involving religious and cultural leaders, and countering myths such as discarding colostrum further strengthens acceptance. Early registration. This we are still at the process of early registration of pregnancy. This should be done as early as possible to ensure structured antenatal breastfeeding education. The next is the hospital-related factors also contribute to the delays. Strengthening the baby-friendly hospital initiative can help by training maternity staff to assist in early breastfeeding support, prohibiting formula and bottle promotion, encouraging 24/7 rooming in for mother-baby bonding, supporting breastfeeding after cesarean section through immediate skin-to-skin contact and early latching, ensuring round-the-clock lactation support in the hospital. Now, to enhance breastfeeding support, hospitals must integrate training, educational videos, and visual materials into maternity wards. We need to empower healthcare professionals to promote early breastfeeding initiation. This requires specialized training for doctors, nurses, and grassroots health workers, ASHAs, ANMs, Anganwadi workers, trained birth attendants, CHW, community health workers, DOLAs, peer counselors on colostrum benefits, positioning, and counseling. Workshops, ongoing training, education material, and CME programs should be there to build skills. Integrating lactation education into medical curricula for a long-term impact should be started. Now, it's important to realize that breastfeeding is a journey that begins before birth. Learning and preparing during pregnancy can make breastfeeding smoother and more successful. That's the reason why I was talking about that prenatal breastfeeding promotion or education should start during pregnancy. Early registration will help in this. Antenatal education should be a part of a comprehensive support program that continues after birth. Mothers should be consulted at every prenatal checkup, visit and receive guidance on breastfeeding. This should include why breast milk is superior to formula, how how breastfeeding works, and what to expect in the hospital after delivery, such as skin-to-skin contact and early latching. Understanding the risk of unnecessary formula supplementation also empowers the mothers to make informed feeding choices. Identify and address challenges which may make breastfeeding harder, such as flat or inverted nipples, previous breast surgery, or hormonal issues. You might not have to do anything antenatally, but definitely you need to address these challenges so that the mother is not undermined. Patient-centered education should be clear and easy to understand, preferably in her own language and culturally appropriate. Including family members in discussions help create a strong support system. Make it easier for mothers to continue breastfeeding. Suffice to mention that prenatal breastfeeding education enhances knowledge, promoting earlier initiation. Now, I'm just nearing the end of my talk, but this is a slide which I wanted to show you that the Academy of Breastfeeding Medicine Clinical Protocol 19, which was first introduced in 2015 and has been revised in 2014, that is breastfeeding promotion in the prenatal period. The Academy of Breastfeeding Medicine emphasizes that prenatal breastfeeding promotion improves initiation and duration. It should be a part of comprehensive support program with counseling at every prenatal visit covering breastfeeding benefits, hospital practices, and potential challenges. Last but not the least, though this HMB is not a part of the early initiation of breastfeeding, but I have already mentioned the importance and role of early initiation of breast milk through human milk banking. Early initiation with mother's milk or donor human milk offers not just immediate benefits, but also long-term advantages for low-term weight infants, significantly improving their survival and quality of life. As I've already shared with you, that NICUs with human milk bank report about 13% higher rates of exclusive breastfeeding at discharge. So with that, I end my talk, and I think so this is the time to celebrate with Punjabi Dangra. I hope you all enjoyed. And this is the YouTube channel which I was talking about. My all sessions are available on YouTube channel. Still, I am adding some more sessions. These shots are available on the Insta, as Madam said. Not full sessions on LinkedIn, Insta, and other social platform like Facebook, etc. So I hope you all enjoyed this session, and I'm clear about early initiation of breastfeeding. Thank you very much.
Thank you, sir. That was absolutely an excellent and fabulous lecture, which brought in so many learning points, and you have covered it so lucidly that I'm really left with no words, So beautifully depicted all the important points and the real challenges, especially in a country like ours. And you've also enumerated all the data to support all your things. I think it was absolutely a great lecture. We'll open the house for some questions. And if nobody is asking, then I'll ask you.
I request all the delegates to put on their videos because it adds a personal touch to the interaction.
Yes. And please put your questions in the chat so that, we would know who is asking what.
Excellent presentation, Dr. Gulati, as I had
Yeah.
anticipated.
Thank you, sir.
Yeah.
Thank you. I hope you like that video of that puppy.
Yes, very nice.
Yes.
Yeah.
Sir, while people are putting in, maybe I'll ask you a
Sure.
question
Sure.
in the meanwhile. You said that for non-nutritive sucking, we can try the finger when it is clean and all. How about trying the breast itself after we have emptied it? That is what we practice, at least in Nair Hospital and another municipal hospital. So for non-nutritive sucking, we express the milk. Mother is asked to express the milk, empty it, and then, because she feels so much better, the contact is even better. And later, if the baby needs to be fed, this milk is given either through the bondla or a orogastric tube. So what is your suggestion? What is your first method that you would use?
Yeah,
Directly
ma'am.
on the
Very,
breast?
no, very rightly. You are very right in saying that we should directly put onto the breast. But my actual concern was because I was considering babies from 28 weeks to 36 weeks. The
Okay.
the more the premature baby, the difficult it is to pick the baby and put the baby to the breast. Probably the baby is in the NICU or some kind of a care. So that is
Yeah.
the part when you cannot bring the baby to the breast. If you can bring the baby to the breast, that's all the more very good for the baby as well as the mother if that non-nutritive sucking is done with the nipple. But there's one thing, more the premature the baby, it is difficult for the baby to open the mouth fully and take the breast so that the nipple touches the palate. It is difficult for the baby. As the baby comes to 32, 34 weeks, it is easier for the baby to have that kind of a non-nutritive sucking. So I think so with prematurity, finger is better, and as the child matures, breast is a better option.
I agree, sir, to what you're saying, but I also differ a little. If the baby is very premature, he's not going to have the usual suck, swallow, suck cycle. But it is said that even two or three non-nutrient, ineffective sucks are also very helpful. And the baby gets all the microbiomes from the breast and that milk, which is far more helpful. I do understand that very small babies with very less weight, the mothers and the nurses, doctors, everybody is hesitant. But the best way I still feel is to bring the baby to the breast. Try these two or three ineffective sucks, it's okay, and then supplement it, with your finger sucking, because the suck will remain the same. An ineffective suck, whether you put the finger or the breast, is what I think. And let me find out more references for this, and
Yeah.
then we can share with each other.
Yeah, no, I fully endorse breast is the best part to give non-nutritive sucking. But
Yeah,
sometimes when the baby is difficult to
sure,
handle, bring
sure.
to the breast,
Dr.
then
Bodhankar is here, Dr. Bodhankar, sir. So, Dr. Bodhankar, are you there? You wanted to ask a question you had raised.
He was asking for sharing of slides, so I said only if we get
Can I
permission.
add something?
Yes,
Yeah,
please,
Dr.
ma'am. Manglavani, ma'am.
Yes, Gulati sir,
She
really.
is our senior most obstetrician and our ex-president, and she is responsible for all of us getting the IBCLC in India. Over to
oh,
you, Ma'am
wow.
Vani.
Thank you, Sushma. I'm really humbled. It is really wonderful lecture, very elaborative, your slides being so wonderful, and the chronology is so excellent. So I think there is nothing much to ask. One thing I strike, the clothing of the patient also become very important, concerning the initiation. Being obstetrician in many hospitals, I still see, either the gowns are tied backside or it is only, half breast open. And for us, it is then very difficult even for the staff to help the baby to put on the breast. So that also antenatally to prepare the mother and the family. I just share my experience. Recently, I was called in one hospital to see the patient, and she had a beautiful front open clothing. And I just asked the mother-in-law, how come now she's front open clothes she's wearing? And you know what the mother-in-law said? Because I was working in UNICEF and I was trained there about the breastfeeding, and that is how we have done all the preparation. So it just shows the importance, once we do proper education and preparation, how much difference does it make? Thank you.
Yeah, I would like to add this point is very, very important. I should consider taking this point in the antenatal education as well,
Yes.
because
Yes.
clothing for delivery and thereafter should also be part of the antenatal education.
Thank you.
Sir, one question from my side. You have worked extensively in Punjab. So what you found as one of the most important factors which was preventing early initiation in Punjab?
Okay, to be very frank, Prashant, daily I come across a new factor. For example, I tell you, social and this traditions are most common. Uh, that I don't know how far you know that Gulati, they usually give Gulati. Gulati is giving honey or writing home with the honey on the tongue of the child. This is basically done by some elderly person. Till he comes and do it, they'll not initiate breastfeeding. And secondly, there is a tradition that a sister-in-law will come and she'll wash the breast and she'll give breastfeeding, uh, take the child and give breastfeeding. So all these things basically they come under one umbrella. There's just the traditions or the attitudes or the parental norms, which are the hindrances here, and we have to come out of
Okay, so social problems are the most important
most
according to you.
important problems.
Okay.
Yeah, and not because I'm in a government and I cannot comment on the private hospitals and where the issues are somewhat different, taking the child to the nursery, keeping for another 24 hours till the child is taking feed and then giving to the mother. So they are the different kind of factors which basically they are the challenges with which we are not able to cope up in the private sector, I think so.
Dr. Roshni has written a few challenges. Can you unmute and please tell Roshni?
Ji
Are you
ma'am,
still?
hello, how are you everyone?
Yes.
Sir, an excellent presentation. So just from practice, I just wanted to share like the challenges that we get in initiating in the first hour. Mostly it's the relatives, the presence of the relatives, the happiness and all those things that's going on, the celebrations. 1 hour passes by there before we get the baby to the mother. And then it's very challenging in cases where the mother is not having confidence, especially if she's having an inverted nipple or if an emergency cesarean is done and they are not at all prepared about breastfeeding. And, how do you hold the baby like this and take on in laid back position or sideline position, those challenges. And when practically, even if they attempt and not see a drop of milk coming, so it's very again challenging to convince them that no, still you need to continue this and not supplement. So I just wanted, if anything, anything from your experience that we can get so we can aid these mothers in these cases.
Ma'am, again, you are from the private sector or government?
Yes.
Private.
Yes, sir.
Madam, go ahead with the antenatal classes. That is the best thing what you can do.
That is the best thing. That's
That is the
right.
best thing.
That's right.
Right.
The thing
Yeah.
starts from the antenatal thing. Sir,
Yeah.
another question from Dr. Alka Kute, our ex-president also, and another obstetrician and gynecologist who's a die-hard breastfeeding supporter. Yes, Alka.
Hello, hi, Dr. Rajinder. Excellent talk as always. So I missed the talk. It was full plus capacity. So I was certainly trying again and again, and then I got the chance. One question, Mangala Mani, very problem face. Attend the early stage patient, especially Roshni was telling, primary patient. In our area, rather, what happens, they keep everything ready. They keep baby's clothes also ready, but sometimes they want to purchase everything after delivery because there is some misperceptions or some prejudiced mind that nothing will be purchased before delivery. So they purchase and all those things when we visit the patient. Till then, 72 hours are already gone, and the main complaint is baby is not taking proper latching on properly. And when I see the picture, same what Mangala madam has described, 1/4 of the gown is open. Baby is not at all in contact with the skin to skin contact. Lot of that pet patta and kya bhi bante in this modern era also. And so, foremost important thing I think for antenatal section should be mother and baby breastfeeding friendly clothing, not only for the baby, because sometimes they the baby naked only. Then we are to bring those things because of the chances of hypothermia. But in that case also, they keep the baby in the mother-in-law's lap, and the patient is sitting. And when she starts breastfeeding, she has that clothing. Both of the gown is open. Baby is away from the patient's like skin to skin contact. So I think important part what Mangala madam so has suggested. We miss all these things in antenatal session. So that they should keep one bag full of baby's clothes and mother's breastfeeding friendly clothes, so that they can immediately start latching on properly, direct skin to skin contact. They can have shirts also or even front open gown. So we find this integral part whenever we conduct antenatal sessions.
Thank you, Alka. There's a question by Dr. Mahima has commented. Dr. Mahima, would you like to tell, or do you want me to read? Are you still there? Mahima, can you unmute?
Yeah, ma'am. Good afternoon.
Remember, introduce yourself first because in short, and then ask the question.
Good afternoon, all my dear seniors. This is Dr. Mahima Pandit. I'm an IBCLC and MBBS doctor from Satara and a proud BPNI member. So I just had to put few points forth here that the way sir told about inverted nipples and all these things can be countered better in antenatal education. So recently, due to some knowledge dispersal in Satara obstetricians, I'm getting second gravida women coming in pregnancy itself for issues like inverted nipples. Otherwise, it was always used to be after the delivery. So that was my point, which I put in the chat.
Okay.
One or
So
two
I just
comments I
wanted
would
to
like to
highlight the
make.
importance. Sorry, sir.
Okay, you continue. You want continue? You continue.
No, so that's what I wanted to highlight the importance of antenatal education when such situations arise in our private practice.
I just wanted to say that we have a YouTube channel called BPNI Maharashtra. So
Yeah.
there we have kept a video on initiation of breastfeeding in Marathi. So there
Yes.
is something called labor room audit in that. So you can, have a look at that video.
Yes.
Initiation is one, according to me, is one of the most easiest thing to change because it is you do a focus training and we the concept of focus training where you teach only take a drive to train all the labor room staff in the entire taluka or district or a state. And if you do a focus training, you will get very fast results. And as far as the clothes are concerned, what we have been recommending is just shirt of the largest person in the family and petticoat. If somebody doesn't like it, you can call it a two-piece night suit, and which is easily available.
Yeah.
So over to you, Dr. Mani. Over.
Thank you so much, sir.
Yeah. Dr. Sandhya Khatse, Dean of MGM Medical College at Nerul, has also put in a comment. Uh, Sandhya, would you like to unmute and tell us?
Yeah. Just one of the participants were telling about rituals and celebration and disclosing. What we do is we don't tell only till early initiation is done. Once everything baby has breastfed, then go and tell them that baby, boy, girl, whatever it is, and go with your ritual by the time the baby is fast asleep. Barriers, we have to only find solution how to tackle these small barriers which are there for the early initiation, and we have to find out an immediate simple solution. You make it a policy that after breastfeeding only go and tell the time and everything. Why do you want to say immediately? That is
Uh,
something.
Okay, thank you. Sandhya, I do differ, but I'll comment later. I'll let Sir Dr. Gulati first comment on this.
Uh, Now, see, it all depends upon the birthing place. I can say the hospital or the institution,
Absolutely.
how you want to handle or how you want to tackle. Um, I think so. It's very difficult to not let the parents know
Parents know
about the
exactly.
delivery, or if something unusual happens, you are in a mess.
Yes. I
But there
agree
are
with you, sir.
yeah, but there are some policies that you can uh, definitely you have a breastfeeding policy in place, and the patient will only come out of the labor room when they have initiated breastfeeding. Similarly, when you are in a postnatal ward, what is the policy there? When you are in a operation theater, how you need to initiate breastfeeding there. So uh, that I don't agree that we do not tell the parents. They come to know from here or there what is actually
Yes.
going on. But
So
we should put the baby to the breast, and then after that, what happens? They are it's okay
I
for them.
I
Yeah.
totally agree with you, Dr. Gulati, and therefore I told Sandhya that I beg to differ over there. आजकल का तो जमाना ऐसे है कि as soon as the baby is born, a photo is sent immediately outside and the entire family is knowing, the husband may be accompanying, so it depends on the area of place. In private practice, where the husbands are attending, they will immediately take a photo and send it outside, and the entire world, the news will go faster than the mother also recovers or sees the baby. So I don't think we can do that. And second is, if for God forbid anything happens, they will say that you're telling us after 1 hour or after 15 minutes. I think we will be medico legally wrong over there. So what the policy, as you said, you write in your policy, even though we declare that the baby is born, but the baby would be seen by the relatives after some time after the first initiation. I think that is a better way of putting it rather than not declaring that the delivery has occurred. The delivery has occurred should be told, but you can put in your policy right outside the labor room that the baby's contact or the mother's contact with the relatives will occur after she has done the first breastfeed. I think that would be a more feasible and a right solution. You know, Anybody else with any other comment? Prashant, Mangla, Alka, any of the other seniors, or anybody in the audience may give us suggestions, but I think you need to declare that a baby is born.
No, I think so.
Ma'am,
What you said is absolutely right. Many times husband is also in, so
And
that is the
yes,
50% of the family is there.
yes. So
And
we won't
this,
divert.
if
Yeah, anything more?
ma'am,
Can't
Yes,
hear
I
you.
also
Madam,
agree.
Yeah.
hello.
So if there is anybody else or any more questions, otherwise we'll leave this question, otherwise
Somebody
it
is
will
asking a
divert us
question. Somebody
from our
asking a question.
IYCN. Yes, Parag, are you
Yes, ma'am.
you
Ma'am,
wanted to ask?
often the mother and the fresh father both are not how
So we
to pick
lost
up
you.
the baby, and
Yes,
relatives are rather at least grandmother, maternal, or somebody is required at that phase. So that part also should be covered antenatally. How to handle? I mean, they just don't know how to pick up the baby, how to attach to the breast. So
that is
maybe
true.
breast roll could help them without much effort. but ultimately the mother has to know how to help, especially if it is cesarean delivery for them. When we tell that you can just lie down flat and take your baby on over you, they don't know how to bring the baby to breast. So
That is very true. It's a learned
human.
art. Yeah. Yes, sir. Please, Dr. Gulati.
Yeah, I think so. I covered that part because antenatal counseling or antenatal education involves the family and the husband. So you need to give them some advice when the mother comes or a pregnant lady comes for antenatal checkup. Ask her to bring her husband and the family. You can involve them also in antenatal. Who is going to take care of the child after the birth? So that definitely will matter.
Dr. Manjari has put up her hand. Yes, Manjari.
Thank you so much, Rajinder sir, for sharing this beautiful insight about initiating of the breastfeeding in the initial first round. Thank you, Prashant sir. Thank you, Sushma ma'am, for such a wonderful
Please
session.
introduce
I
also
just
yourself.
want to share my experiences with the mothers. I used to take prenatal classes to train the mother about not only breastfeeding but the birthing also. And we used to have husband compulsory with the mother. And I have seen that they have very beautiful experiences together to welcome the baby and to initiate the breastfeeding. And I found that it's really helpful to both of them to understand the importance. And I usually train the mother to have skin to father also, so that they can feel that they are having that togetherness during that journey. And I just during the session, I received a call from a mother that she just delivered 3.7 kg baby normally and initiate the breastfeeding within first hour. And she was so
Wow.
happy and shared this. So it's really mystic that while doing this session, I just got the call and the father informed me that, ma'am, thank you so much. We have very beautiful delivery and the breastfeeding is also initiated. So as Mangala Vani said that the clothing is very important. So I also teach the mother, don't use feeding gown at least for 6 to 8 weeks so that you can give the baby maximum skin to skin contact at least during breastfeeding. Not if it's not possible to give the skin to skin at any other time, but at least during skin to skin time she can feed the baby. So I usually suggest them to use front open shirts or simple t-shirts so that she can pull up and start the breastfeeding to the baby. And if it's possible to maintain the privacy, it's very good to use this kind of clothes. So thank you so much everyone for this insights and learning and
Thank you.
training
Thank
us,
you,
Dr.
Manjari. Could we
polishing the
know
Madam,
where you're
knowledge.
practicing,
I'm
Manjari?
currently in the Gurgaon, but earlier I was in Pune.
Okay, wow, great.
Sushma Madam, it's beyond 4:15, so we
Yeah,
have to
just
draw a close
last
section.
one comment, just very quickly. Anaga Kulkarni has shared her experience that there was one case of cleft lip, cleft palate, where they started early golden hour initiation within 20 minutes. And they knew about this because of the antenatal prenatal education. Thank you very much, each and everyone who is doing wonderful work. Thank you, Anaga, and all the others who are sharing all these successful, stories. Last question that I'm tempted to ask, put up by Roshni, is any condition where you should not breastfeed in the first hour? Yes, Dr. Gulati.
Ma'am, if you ask me personally, there are many conditions, but on the spot, what actually comes to my mind is the well-being of the baby. Wherever you are in doubt, maybe of anything, excretions, cyanosis, saturation, anything, take care of that first, and then only go ahead with that
Yes.
initiation, because resuscitation will take priority. And that is
Yes.
the first and foremost thing. Don't take the child blindly and put him to the breast.
Thank you, sir. Thank you very much. And I know you mentioned in your slides about sudden unexpected perinatal collapse, which is very important. And he told about how to do the monitoring. With that, I think we close the question hour session. I would request my colleague and secretary of BPNI Maharashtra, Sangeeta Jadhav, to give the vote of thanks.
Before Sangeeta delivers vote of thanks, since this is the inaugural session, there are many new people who have joined apart from the routine BPNI faculty, core faculty. So from two people very quickly, I would like to hear what are their expectations in future about these sessions for them. What do they expect out of these sessions uh, to progress in near future?
Parag, why don't you tell us something? Sorry that I
I
could
think
see you right
I've
in
already
front. So,
I've already mentioned that this is a very nice platform for interaction between like-minded people, and this is something which we should keep on. Basically, our interaction will give one or other new things to each and everyone, and whatever we are practicing, whatever we are finding beneficial, that can be used by everyone. So I think
okay.
whatever other people have been saying, I was experiencing that the same thing I'm experiencing in my practice as well. There are some points where I'm blocked, where I find some solutions, and maybe I could also give to someone else. So this is really a nice platform, ma'am.
Thank you. Anybody else, or
The
should I
success
just
of this
choose?
platform depends on you people contributing. We are not planning
Yes, yes.
anyway to, open a mine and get guest speakers or, generate presentations of case studies. The participation has to come from everybody, and that is something new which everybody else would like to hear. One more comment, comment from somebody who joined new for this platform, and then we'll go to vote of thanks.
Doctor, can I just randomly pick up? Dr.
So let him answer.
Swati.
Let him voluntarily answer.
Okay,
There are many
okay.
people who.
Anybody, please? Would
Sir, I
love to
think,
hear you.
ma'am, may I?
Yes, who is
Yeah.
it? Please
Yes,
identify.
yes, this is Dr. Saili. Thank you
Yeah.
very much for the wonderful session and the new initiative first. And we would like to have discussions about, different cases and practical solutions for the same and discussion about the same. Will help us in practice also and in exams also.
Thank you, Saili. That is nice to hear from you, especially if I'm not mistaken, you did have preterm baby delivery. Is that right?
Yes, ma'am.
And so there were lots of. So good. Thank you for your, feedback. And Prashant,
The
anything
case
more?
discussions will need to be short. A presentation in 5 minutes, discussion over next 5 to 10 minutes. A case should get over in 15 to 20 minutes. Otherwise, any clinical case can be too short or it can be too pulled for too long, great length also. So that has to be, we can prepare a presentation, send us the case. If we feel that, it can be put up and discussed, then we'll get back to you. So I think we are finished and there's a limit of time also. So I request Dr. Sangeeta Jadhav to proceed with vote of thanks.
Thank you so much. Thank you, Dr. Rajinder Gulati, sir, and for accepting our invitation and preparing so nice presentation, the graphics and everything. Though the topic was new to all of us, still you made it so interesting. And everybody, as everyone commented in the chat, it was excellent topic and presentation. And the small points also you had mentioned in it. And I'm sure all the questions people asked were already answered in the slides presentation. And if you thoroughly follow each and every step, every point you discussed in the presentation, I'm damn sure that the initiation rate will go high. As per my own experience, I also had delivered twins who were premature 33 weeks, and I was in recovery for almost 3-4 hours. And during that time, my husband took care, means skin to skin and that. And still, we made it sure that we can, as soon as I recovered, and we made it sure that we can provide our colostrum to the NICU. So, as perfectly you said, here comes the importance of ANC practice, motivation, family support. Everyone's role comes to play here, and healthcare system. And that is where then again BFHI, on which BPNI Maharashtra is working a lot. So this will be a very good things to incorporate. So I again thank you from my bottom of the heart for taking out time for this session. I'm thankful to Dr. Prashant Gangal and Dr. Sushma Malik for initiating, arranging this first session of our inaugural session of our learning and making it open for all BPNI faculty and again announcing it for every 15 days. And I'm sure people will come ahead and give their topics and preferences, and we can allot as per the schedule and availability. So once again, thank you for all the delegates who attended this program, and looking forward in for different topics and even attendance in full enthusiasm. So
And
thank
it
you
is
so much.
houseful today, houseful today. So I think we should thank the delegates also.
Yes, it was helpful.
Okay, thanks.
Yes.
Thank you very much. And now in our traditional style, we always have a photograph in the end.